Hi, I am Dr. Melanie. How can I help you today?
Hi. Um, um, I only have a constant hair loss for more than 300 hairs of day, and I have also gained weight 3 kilograms, and I feel tired all day. I have a depressive state, occasionally constipation.
Okay, let me ask you a couple of questions about your ID first, and then we continue. Okay.
Okay, okay.
First, can you give me your full name, please?
Okay, my name is Carlos Alfredo Alonso Gutierrez.
Okay. Next, how old are you?
I have 23 years old.
Okay. And can you give me your date of birth, please?
Yes, September 21 of 1999.
Fine. And can you give me your address?
Okay, Sendero de la Fortuna Street, 37, Milenio 3, Querétaro, Querétaro.
Okay. And your city of origin is in Querétaro.
Yes,
Okay. Your nationality is Mexican.
yes,
Okay. Can you give me, well, you finished your high school.
yes, high school.
Okay. You are single or married.
Cinco.
Okay. What is your religion?
Atheist.
Okay. Can you give me your phone number, please?
Yes, 44, 26, 47, 33, 73.
Okay. Which person do you like to be your emergency contact?
Yes, my mom is Isis Alejandra Gutierrez Gonzalez, and her number is 44 21 23 45 6.
Okay. Let's pass. Well, now can you give? Do you know your blood type?
Yes, is O positive.
Okay. Now we could pass to well, you will answer me a few questions.
Okay.
Now tell me about your childhood illnesses. Do you have suffered some illnesses like smallpox or anyone?
Yes, yes, yes. At the age of 6.
Okay, and how about your do you have you had any surgery?
Yes, fracture in the lateral right hand for 4 years ago without complication.
Okay, do you uh, have any trauma?
Yes, the fracture in the lateral right hand 4 years ago without complication.
Okay, do you take any medication?
No,
Do you have you had a blood transfusion?
no.
Okay, do you have your complete vaccination card?
Yes, the complete including COVID-19 and influenza booster.
Okay. Do you have any psychology illnesses?
Yes, I have depression treated with psychotherapy.
Okay, let's pass to another questions. Tell me, I will ask you some question about your family. Does anyone in your family have diabetes?
Uh, yes. My paternal grandmother have diabetes for years, and let me think. Mm, and my maternal grandfather for 3 years and treated with metformin.
Okay. Your how about your mother? Does he have any illnesses?
Who?
Your mother.
My mother? No, my mother is healthy.
Okay. And how about your father?
My father is alcoholic for 1 year, degree of obesity, when detected 3 years ago.
Okay. And tell me about your maternal grandmother. Does
My
he have?
maternal grandmother has scoliosis detected and treated 3 years ago, and Parkinson disease is detected and treated 2 years ago.
Okay. And your maternal grandfather?
Suffered from arterial hypertension for 6 years and treated with losartan for more than 3 years. Diabetes for 3 years and treated with mirmosfin. Suffered with Alzheimer's detected 3 years ago. Has cataracts for 4 years ago.
Okay. Now the paternal grandmother and father.
Yes, the paternal grandmother, she has suffered from diabetes for 4 years and is being treated with and controlled. She had diverticula for 2 years and has operated on 1 year ago. My paternal grandfather was an alcoholic for 10 years, currently healthy.
And how about your, do you have brothers or sisters with any
Yes,
illnesses?
I have two sisters and one brother, and my brother have autism detected 10 years ago and under treatment.
Okay, let's continue with your habits and your social life. And
Okay.
do you smoke?
And
Do you vape or e-cigarettes?
yes, occasionally.
Okay. Do you currently drink alcohol?
And yes.
And the type of alcohol do you drink?
Vodka, only to live.
Okay. Do you use any substance such as cocaine or marijuana?
No.
Okay. What is your highest level of education complete?
High school.
Okay. Are you employed?
No.
How about your diet and
Uh,
your habits?
mm, I have good habit and I have a quality and quantity of food is good.
Okay. And do you do any exercise or sports?
And no, I don't have time.
Okay. How about your habits of sleep?
I sleep 6 hours per day.
Okay. And do you have any pets?
Yes, I have 3 cats, and I sleep with my cats in my room, and I have one dog that sleep in the backyard, and all them have their vaccination up to date.
Okay. Do you have allergies?
No, no.
Uh, um, okay. Tell me about your personal hygiene.
I take a bath daily and change and the change of clothes and brushes my teeth is 3 times a day.
Okay. And do you like or do any hobbies?
I like to play video games with my partner, eat with my family, and spend time with my friends.
Okay. Do you have any tattoo or piercings?
You know,
What is your marital status?
single, but I have a boyfriend.
Okay. Are you sexually active?
Yes,
Okay. Starting age, at what age?
16 years.
Okay. The total number and gender of sexual partners.
Just six and all men.
Okay. Number and gender of sexual partners in the previous 6 months.
One, I mean,
Okay. Do you use any contraceptive method?
condom.
Okay. Do you have sexual problems?
No.
Okay. Let's start with another questions.
Okay.
Do you currently have any symptoms? Do you feel tired or with cold?
Yes, I feel depressed, and I feel that I waste lost weight and tired all the time and feel like weak all the time.
Okay. Um, have you had reflux, constipation, diarrhea, or pain?
Yes, constipation occasionally every 2 times a week, accompanied by abdominal pain throughout the colic frame.
Okay. Have you present chest pain or tachycardia, palpitations, different from normal?
And
Okay. Have you had pain when urinating, strong urge to urinate or incontinence?
no,
Okay. Have you had bleeding for not apparent reason, bruises, tiredness, or headache?
no,
Okay. Have you felt that you gain a lot of weight or lose a lot of weight changes in your skin or hair?
yes, I weight gained 3 kilograms 1 month ago. Soft nails, hair loss more than 300 hairs per day.
Okay. Have you presented dizziness, headaches, nausea, or fainting?
No,
Have you had changes in skin color, ulcers, bruises, malformation, or skin spots?
only the soft nails and the hair loss.
Okay. Have you present pain in lower or upper limbs, loss of strength or sensitive?
No,
Okay. Do you have abnormalities in your genitals or blending? You felt anxious, depressed, or stressed?
can you repeat the question, please?
Do you have abnormalities in your genitals or bleeding?
No.
Have you felt anxious, depressed, or stressed?
Yes, depressed.
Okay, fine. Let's start with your physical examination.
Okay.
Um, you have a blood pressure of 120 over 60. The heart rate is fine, 75, respiratory rate 16, and temperature of 36. Your 1 meter, you the height is your 1 meter point, and the weight it is 73 meters tall, and the weight is 68 kilos. Let's start to another the final examination, the physical examination, to rule out any disease. Let
Okay.
me do it. I'm going to ask you to carry out a laboratory test to TCH to be able to rule out of thyroid disease. For the time being, I will not send you any treatment until you bring me the test, and I ask you for your next appointment, that it is on October 15.
Okay.
With the results, I will be able to give you a better diagnosis. Do you have
Oh,
any questions?
no, I don't have questions.
Okay, that is all for my part.
Okay, thank you, Melanie.
See you soon. Bye.
Okay, bye.